Good morning, everyone, and welcome to Presentation Session 1, Justice and Social Geography. I'm Laura McElfresh, Cartographic Metadata Librarian at the University of Minnesota Libraries. I'll introduce each speaker before their presentation, but we're going to go ahead and hold question and answer until the end on this one. Please use the question and answer feature to ask your questions. I'll be monitoring that. And you can also upvote other people's questions too if you like. And use the chat for any technical problems by notifying just the host and the panelists. So we are going to go ahead and get started here. Harvey J. Miller is the Bob and Mary Royce Chair in Geographic Information Science, Professor of Geography, Courtesy Professor of City and Regional Planning, and Director of the Center for Urban and Regional Analysis at the Ohio State University. He is also an affiliate of the Translational Data Analytics Institute and a member of the advisory board of the Sustainability Institute at The Ohio State University, and a faculty affiliate of the Center for Injury Research and Policy at Nationwide Children's Hospital in Columbus, Ohio. He has a PhD in geography from The Ohio State University. Professor Miller's research interests include geospatial data analytics, transportation science, and urban science, in particular sustainable mobility, resilient communities, and the relationships between human mobility, environmental justice, and wellness. He is the author or co-author of over 200 scientific publications. So here's Harv with the Ghost Neighborhoods of Columbus project. And please just let me know when to advance the slide for you.
Sure thing. Okay. Good morning, everyone, and thank you for this opportunity to present on this project called the Ghost Neighborhoods of Columbus. And let's go right to the next slide. Now, what's motivating this project is something that happened in Columbus and something that's happened in many American cities, is that in the 1960s, urban highways were built, and they were built mostly through Black neighborhoods. They were built through these neighborhoods because these were vulnerable populations that couldn't put up didn't have the agency to put up the political resistance to these highways. And also because in some cases it was explicitly to do so-called urban renewal in some of these neighborhoods. And we have examples of this in Columbus, which I'll show on a map in just a moment. But again, this is a very common story in the United States. And not only did this cause a lot of disruption and damage to these neighborhoods historically, but it's a legacy that these neighborhoods live with today. Some of the neighborhoods I'm going to identify are basically walled off from the rest of the city by freeways. In some cases, the neighborhoods have been bisected, lives were disrupted, businesses and homes were lost, and these neighborhoods still live with the disadvantages of these highways, including air pollution, noise, higher risk of road trauma, and greater, stronger urban heat island effects because of the concrete and lack of trees and intensifying, solar heating during heat waves. Next slide, please. In Columbus, we have 3 neighborhoods in particular, which we're highlighting in this project working on the ghost neighborhoods. One is called Hanford Village, which is what I'll be showing you some results from today. Another one is called Bronzeville, and there's one called Flytown, which you can see in the map in the upper left corner, and that's a neighborhood was completely destroyed by the construction of I-670. Very little trace of that neighborhood exists. It was a neighborhood that was populated by African Americans, but also a neighborhood where immigrants, when they first moved to Columbus in the early 1900s, that's where they would settle down. I'm going to be focusing on a village a neighborhood in particular called Hanford Village, because it's a particularly tragic case of what happened with urban highway construction in the 1960s. Next slide, please. So Hanford Village was actually incorporated in the early 1900s, but they created a subdivision in the 1940s, in the mid to late 1940s, when African American veterans were returning from World War II. And they, in order to get funding under the GI Bill, to pay for their homes, they had to, of course, not be in a red line neighborhood, but they also had to have new homes. So this subdivision was built in the 1940s of Cape Cod homes, and it was occupied by veterans and families of veterans from World War II. And then in the 1960s, I-70 and another road nearby called Alum Creek Drive came by and basically decimated this neighborhood. So this was a story of a self-governing enclave in the city of Columbus, had their own government, had a viable neighborhood that lasted for 20 years and was wiped out by highway construction. It's again a particularly tragic case of what happened to U.S. cities in the 1960s with these highways. Next slide, please. So this is an example of some of our research. As part of this project, besides some of the visualizations, which I'm going to talk about a little bit later on, we're actually doing some archival research, including finding historic photos and georeferencing them, both to inform our visualizations, but also to tell stories around what happened in these neighborhoods, to talk about the lives and the people and experiences that existed and then were disrupted. Now, here's another kind of dramatic example showing just north of Flytown, which I showed you on the map. This is Goodale Park, which is a park just on the northern edge of downtown Columbus. This is facing west. We're in the southwest corner. March 3rd, 1957. We're looking at Flytown there on the south side of the street as we're looking west. 2 years later, next slide, please. That's what was left. The entire neighborhood just completely wiped out by interstate highway construction. So yes, thank you. Next, this slide, yes. So what we're doing in this project is that we're trying to reconstruct some of these lost neighborhoods that were damaged or destroyed by highway construction and urban renewal in the 1960s and 70s in Columbus. We're focusing on these neighborhoods identified before, Hanford Village, Flytown. Another one we're looking at is called East Franklinton for a different reason. That was a neighborhood that was one of the densest neighborhoods in Columbus. It was across the Scioto River from downtown Columbus, one of the densest neighborhoods in the city. And in 1913, it was wiped out by a major flood. And that's one of the things we're also looking at, is not only the legacy of urban highway construction and urban renewal in Columbus on some of these vulnerable neighborhoods, but also looking at some of the environmental history. And in both cases, we're looking towards the future. What should we do about these highways? What should we do about urban flooding that's coming in the future? And trying to look to the past in order to understand how we could do things differently in the future. Now, what we're doing in this project is creating high resolution digital reconstructions at the parcel and building level. Information on the number of floors, construction material and usage. Was it a dwelling? Was it a commercial business? Was it an institution? Was it industrial? And some of the products that we're generating from this project are maps with databases, 3D visualizations, story maps. We're actually going to embed these 3D visualizations into web-based story maps that include some of the archival data we're collecting and georeference photos and the stories and narratives and so forth of the lives of the people that used to live in these cities. In terms of the 3D models we're building, we're also developing a scalable technique. What we're doing here is almost completely automated. Could be, there's some places that you need some human intervention to do some error checking and things like that. But we're developing a method that could be applied very widely, could be done at an urban scale, and could be done really in any city where the base data exists. Next slide, please. So this is the data we're using as our base data. Some of you may know about this. They're called Sanborn fire insurance atlases. These were produced by a private company for cities, for thousands of cities around the U.S., and they were for fire insurance underwriting purposes. And in Columbus, we have this data, these Sanborn fire atlases, for the dates you see on the screen, going back to 1887 all the way up until 1961. And right now, since we're focusing on highway corridors, we're using the 1961 data because that was just before some of the highways were constructed in Columbus. What you see there is the index page for the atlas. That's showing the Ohio State University campus neighborhood, and each one of those polygons is an atlas page that has building level detail of all the buildings in the neighborhood. Now, the good news is that all of these Sanborn fire atlases have been scanned and digitized and are available in digital form. And that's what we're working with, the imagery, rather than the atlases themselves. And in particular, the Library of Congress has full color, high resolution scans of all these atlas pages for different cities around the country in different time periods. Next slide, please. So this is what it looks like. And if you're not familiar with Sanborn fire atlases, you should be. It is really a treasure trove of information, just unbelievable how much data there is on these maps. So you could see what we're seeing there is an atlas page, and we're seeing also the legend of the atlas. And you could see that we're seeing every building in the neighborhood. We're seeing the streets. We're getting, it's color coded based on the construction material. We can see whether or not there was a front porch or a back porch. We can see where the windows are. We can see, if there are garages or carriage houses back in the alleys, and we also know the basic use of the building. Was it a dwelling, business, institutional, or industrial? And what we're doing is we're basically first geo-referencing these atlas sheets because they're not geo-referenced, they're geometric correct, but they're not geo-referenced. And then we're using machine learning to segment the objects and extract attributes from the annotations. Next slide, please. So we're using a form of machine learning called support vector machines. And I don't want to get too geeky here, but I just want to tell you that what this is, support vector machines, is that it's a form of supervised machine learning. So what we do is we take one of the atlas pages and we manually label it and on the image, and in order to give examples of correctly labeled buildings and attributes. And then once we do that for an atlas page or two, and we have enough of this training data, we train the model, and then we apply it to the entire atlas, and it can classify, and it turns out at very high accuracy. We're getting accuracy measures, of 90% and above. So we do this by first extracting the building footprint pixels, like picture elements, and then we classify them and transform into building objects. And then we apply simple rules in order to clean up some of the errors. For example, we know that walls of the building are straight lines and they intersect at right angles. And by doing that, we can clean up all these little tiny errors from the machine learning algorithm and create realistic looking buildings. Next slide, please. So I'm going to show you, I fortunately can't show you a demo live. I'll try to put something in the chat. I'm having a little problem pasting into chat. There might be some restrictions on that or something, but I just want to show you the different type of products that we've generated from this. So this is showing our first generation product when we just got abstract buildings. So in the first stage of this, we actually just get the geometric polygons of the buildings without any attributes or color or realism. This is showing Hanford Village, as I identified on the map, and the blue double lines there is I-70, and the red ghostly-like buildings that are in the highway corridor are buildings that were destroyed in order to construct I-70. Based on this analysis, we've identified about 300 buildings that have been destroyed. Did someone speak up a moment ago?
Yeah, that was me. Do you want to go ahead and try to share your screen?
Oh, sure. Okay, well,
Yeah,
let me get to that slide first, if you don't mind. There's
sure thing.
our slide. Can we go back to the slides?
You bet. Okay.
There we go. There we go. Okay, so this is the second, in the next slide, I'll want to jump out, but this is the second generation product. So after we got the building polygons and attributes and generated the geospatial database, we then fed it into ArcGIS City Engine. And right here we see these are the default buildings. And these buildings don't look very realistic. It looks like a neighborhood perhaps in Lisbon or something like that. And these are just the default building language that comes with City Engine. So what we did in order to make this more realistic is that we took some of the georeference photos of the neighborhood and we studied the architectural types, and then we were able to edit the building language, and next slide please, and get to more realistic buildings. And now if I can, I'll show you a live demo. Oops, can I, there we go. Perfect, okay, here we go. I'll just share the screen right here. Okay, I think you can all see my screen here. So this is actually the live database here. This is showing our visualization. This is the Hanford Village, another neighborhood called Driving Park. And it is in fact a 3D database. So we have 3D buildings here. We can scan through the image. We can look at it at different angles. was constructed out of frame or wood. We know that it's 2 stories, and we know that it's a it's a
Harv, I'm wondering if you're freezing up because the screen share is lagging. I'm sorry. Shall I go back to the slides?
Yeah, go back to the slides, please. I'm sorry about that. We tried.
Yeah. Okay, so would you turn off your share, please, so I can go back?
Yeah. Oh, yeah. Sure. I thought that. No, I should. I cannot share now, so it should be. You should have control.
Okay.
There we go. I think.
Yeah, here
Okay.
we go. All right, back on
Okay.
track.
Sorry for that, folks. We tried.
We did. I'm sorry. And we'll get that link into the chat in between presentations.
Okay. Great. Next slide, please. Then. Again, apologies for that. Okay, so the other data that we're incorporating into this project is that we're tracking down some historical parcel data, looking at business permits and building permits. We're tracking down street imagery. We're looking at historical documents. We're also going to be looking at the National Historical GIS that's at the University of Minnesota to try to get some historic micro-level census data. And as I mentioned before, we're collecting stories and memories from residents to embellish these 3D visualizations with actual stories about the lives that used to be lived in these neighborhoods. Okay, next slide, please.
Okay.
And that
That.
may,
There we go.
okay, there we go. And one thing we're really happy about is that this project has really resonated locally. We're getting lots of media attention locally. And this kind of proves our point. One of the points of this project is that it's one thing to talk about the damage that these highways have done to these neighborhoods. And it's one thing just to kind of present like charts or tables of what was lost. But when you actually can visualize it, it creates like a visceral, almost emotional feeling. And that's the kind of the reaction we're getting locally, that when we show these visualizations, like basically everyone gets it right away. And there's a lot of local level excitement over this project. And we've actually are assembling a team of people in the city, local foundations, and some community partners such as the Columbus Landmarks Foundation and the Ohio History Connection in order to help us with this project and really build this out and make it a very, very rich, interesting experience where we can educate the public about the impacts of these highways and urban renewal and environmental history events on our city and understand the past so that we can move forward with a better future. Okay, next slide, please. And I believe that's my wrap. Yes, it is. So it takes a village to do this. And here's my village. This is a team in the Center for Urban Regional Analysis at Ohio State, but also we have collaborators across campus. We just added a few more that aren't on the slide. And we have people, geography grad students work on this project, undergraduate history majors. So it's a real team effort for a very multifaceted and complex and fun project. So hope you enjoyed the presentation. Hope the disruption wasn't too disrupting. And that's it for me. Thank you.
Thank you, Harv. Let me swap out presentations here. And up next, we have Jess Hoffelder, a spatial data analyst for the data and analytics team within county health rankings and roadmaps. She holds a BS in integrative biology from the University of Illinois at Urbana-Champaign. and a master's in public health in environmental and occupational health sciences from the University of Illinois at Chicago. She has been with County Health Rankings for a year and previously completed a Pathways internship with the Federal Emergency Management Agency. Her interests include environmental health and environmental justice, and creating data visualizations and interactive mapping applications. Jess is here to talk with us about using maps to communicate the relationship between broadband and health.
All right, thank you so much for that introduction. And I just want to say quickly, my name is Jess Hoffelder, my pronouns are she, her, and I'm really excited to be here and share the work that my program is doing. This presentation would not have been possible without my incredible colleagues, including Dr. Christine Muganda, Dr. Annie Rubel, Lindsay Garber, Beth Silver, and Tommy Jaime. And before we start the presentation, County Health Rankings and Roadmaps would also like to share a warning that this presentation will discuss redlining and includes references to the racist, classist, and xenophobic notes from the area descriptions created by the agents of the federal government's Homeowners Loan Corporation in the 1930s. This content is disturbing and will not be read aloud, and we acknowledge that some people may choose not to participate in this part of the presentation and ask for your sensitivity towards your needs and the needs of others who may choose not to interact with the content in this setting. Next slide. So today I'll be discussing the content of a web publication and a set of GIFs with maps that was created by County Health Rankings and Roadmaps on the topic of broadband access. Through this publication, which we call a data spotlight, we investigated broadband access and how low broadband access in urban segregated pockets compounds inequities. This data spotlight was published on our website and through our email newsletter on November 15th, 2021, and the GIFs were shared on our social media for several weeks afterward. The topic of broadband was selected because it was highlighted as a critically important service during the pandemic. Additionally, most previous discussion around broadband access centered on widely documented limited access in rural communities. However, pockets of urban areas also lack access. We used the example of Milwaukee, Wisconsin, a highly segregated city still reeling from historical and present-day injustices, to show how residential segregation from the 1930s is still reflected in inequities in socioeconomic health metrics today. Before I get into our work on broadband access, though, and the development of the data spotlight, I'd first like to share some background about our program. Next slide. County Health Rankings and Roadmaps, or CHR&R, provides data, evidence, guidance, and stories to build awareness of the multiple factors that influence health and support leaders in growing community power to improve health equity. County Health Rankings is known for effectively translating and communicating complex data and evidence-informed policy into accessible models, reports, and products that deepen the understanding of what makes communities healthy and inspires and supports improvement efforts. CHR&R's work is rooted in a sincere belief in health equity, the idea that everyone deserves a fair and just opportunity to be as healthy as possible. Next slide. One key tool that we use to achieve these goals is our model of health. The County Health Rankings model illustrates a broad vision for health. It shows that policies and programs at the local, state, and federal levels, the orange box, play an important role in shaping health factors, the blue boxes, that in turn influence a community's health outcomes, the green boxes. Health factors represent things that can improve length and quality of life if modified. They are predictors of how healthy our communities can be in the future. And the 4 health factor areas in the model include health behaviors, clinical care, social and economic factors, and the physical environment. Health outcomes represent how healthy a county is right now. They reflect the physical and mental well-being of residents through measures representing the length and quality of life typically experienced in the community. More than 80 individual measures or metrics are included in the model as health factors and health outcomes. Next slide. Broadband access is a measure of access and opportunity in the physical environment of a community. In our model of health, broadband is situated within the housing and transit health factor area. We added the measure of broadband access to our data set in 2021, and it is a 5-year average based on data from the American Community Survey 5-year estimates. Our measure of broadband access is the percentage of households in a county with a broadband internet connection through subscription. The numerator of this percentage is the number of households in a county with broadband internet subscription of any type, for example, cable, fiber optic, or satellite, at their place of residence. And I will note that our measure of broadband access does not tell us the reason for low access in a given county. Barriers to broadband access could be due to insufficient infrastructure, subscription cost, or personal interest, for example. I think advance 2 slides now. One more. There. So we wanted to bring attention to the patterns and lack of broadband access that aren't well known. We started by looking at the national picture of broadband access. Across the entire nation, 83% of households had broadband access in 2019, with a range of between 35% to 100%. We then compared this to broadband access in rural counties, where it is well known that access is lower. Only 73% of households in rural counties have broadband access, and this pattern is easy to see on a national map. Next slide. On this map, the counties that have a higher percentage of households with broadband access appear darker. And when we look across the country, we can easily see the unequal distribution in access. The concentrated areas in white and light blue illustrate that familiar pattern of lower access in rural areas. However, when looking at a national map like this of county level data, it obscures patterns of access at smaller scales in urban areas. Next slide. As a reminder, 83% of households across the nation have broadband access, and in rural counties, this drops to 73% of households. When looking at urban counties, we found that 79% of households within the 10 most segregated urban counties in the country have broadband access, and this is not much higher than the level of access in rural counties. And this number is at the county level. When you drill down even further to the neighborhood level for an urban, highly segregated county like Milwaukee, it's clear that broadband access is not evenly distributed across a county. As I'll show later in the presentation, there are many areas in Milwaukee where less than 75% of homes have access, a figure that even more closely aligns with the rural county numbers. Ultimately, this lack of access is a reflection of where our society has chosen to invest and where not to invest our resources. We decided to focus on this often overlooked topic of low broadband access in urban areas to highlight that it is not a problem limited to rural areas, and to also bring in some of the historical context behind why this problem exists. Next slide. Many neighborhoods within these highly segregated urban counties have faced historical lack of resource investment as well. In the 1930s, the federal government created residential security maps that reinforced segregation by rating typically Black and immigrant urban neighborhoods as risky real estate investments. Agents of the federal government's Homeowners Loan Corporation assigned grades and color-coded neighborhoods on maps according to their, quote, mortgage security. These HOLC agents used data and evaluations from local real estate professionals to assign these grades. Neighborhoods coded A, which were colored green on the maps, were minimal risks for banks and mortgage lenders. Neighborhoods coded D, which were colored red, were considered hazardous and unsafe for investment. HOLC agents created area descriptions as well alongside these grades. This practice is now referred to as redlining because of the literal red lines drawn on maps around the neighborhoods coded D. This redlining made it difficult or impossible for residents of lower graded neighborhoods to obtain a mortgage and buy a home. Redlining resulted in resources and capital being explicitly directed towards native-born white families in blue and green neighborhoods and away from African-American and immigrant families in yellow and red neighborhoods. This contributed to a cycle of disinvestment that continues to this day. As a reminder, the next portion of this presentation is where I'll be discussing the racist, classist, and xenophobic notes contained within the area descriptions that went alongside the neighborhood grades written by HOLC agents in the 1930s. I'll be sharing examples from Milwaukee, Wisconsin, or Milwaukee County in Wisconsin. Next slide. Redlining occurred in many urban areas across the country, and we investigated the patterns of health inequities and lack of broadband access that exists in multiple cities. However, we felt given our location and partners in Milwaukee, we could best speak to this city. Milwaukee, Wisconsin is a historically segregated city within Milwaukee County. Even today, it is still one of the most segregated places in the country, according to the CHR&R Residential Segregation Index. Government and businesses have invested less in the neighborhoods that span the northern and central part of this county of nearly 1 million, while those along the lakefront and in the suburbs thrive. The scan of this redlining map and the record of the notes from the area descriptions I'm about to share are from the American Panorama Project's Mapping Inequality Interactive Map. The interactive map was created by the Digital Scholarship Lab at the University of Richmond, and I would encourage anyone who's interested in learning more about the history of redlining to take a look at this map, which you can find easily by Googling mapping inequality. It's jarring and heavy to read through the notes recorded on these original maps, explicitly citing the presence of Black and low-income populations as the reason for the quote, hazardous label and red line coding. These notes, which justified the grades and color codes assigned in the Homeowners Loan Corporation map of Milwaukee, make it clear how central racism and classism have been to the determination of community worth and worthiness. Next slide. You might have to click one more time. Okay, and next slide. The legacy of these redlining maps continues in present-day neighborhood disinvestment, including in the form of digital redlining. Broadband service providers make choices to maximize returns on the investment of broadband in a community, meaning that communities with more resources are more likely to receive the investment of physical infrastructure for broadband, opening the door for even more resources and opportunities to flow into the community. In contrast, communities with fewer resources are less likely to be marked as a good investment for broadband and will become further cut off from the flow of resources. This is the practice we are describing when we refer to digital redlining, and it's a continuation of the practice of choosing which neighborhoods to invest in and which not to invest in. Next slide. That's where our data spotlight comes in. The maps in the data spotlight show the Milwaukee census tracts with low broadband access are also largely composed of neighborhoods that were redlined nearly 100 years ago. This is one of the GIFs that was created, which shows the maps of the census tracts where more than 1 in 4 homes are without any broadband access, and the neighborhoods that were graded C and D in the 1930s by the HOLC. The similar spatial pattern of low broadband access and redlined neighborhoods is easy to see in the GIF. I also want to reiterate here why broadband access is important for health. Broadband increases access to healthcare via telemedicine, improves economic stability through opportunities for telework and job search opportunities, and increases food access with online grocery shopping. Access to broadband is tied to improved health outcomes, including lower smoking rates and diabetes cases. Living in the digital age where so much of what we do requires internet access, you can see why broadband is a key driver of health. Next slide. In addition to comparing, okay, there we go. In addition to comparing broadband access to neighborhoods that were redlined, we also compared access to 3 other socioeconomic metrics that have strong connections to health: homeownership, children in poverty, and high school completion. Low homeownership traces back to historic redlining as well, and difficulty in getting loans and buying homes is still a present-day form of disinvestment in communities. Housing is central to opportunities for living long and well, and stable and affordable housing is an essential element of healthy communities. Homeownership allows people in communities to build wealth and is associated with better health, fewer illnesses, and lower rates of depression and anxiety. Children in poverty experience profound and long-lasting impacts on educational attainment and achievement that may result in lower income in adulthood. Additionally, childhood poverty can cause many adverse health outcomes and can impact health into adulthood. Completing high school correlates strongly with higher life expectancies and improved quality of life. Adults who have completed high school are more likely to be employed and earn more on average than those who did not. We initially tested and created maps for more than 10 measures that we thought might be associated with broadband access, and we chose these 3 because they had the strongest correlation and didn't capture the same concepts. We displayed all these maps in this GIF that was included at the top of the data spotlight on the website, and this GIF clearly shows that the lack of broadband access is layered with other symptoms of disinvestment, and that some neighborhoods are experiencing multiple intersecting barriers to good health. These findings of the correlation between low broadband access, more children living in poverty, low rates of homeownership, and low rates of high school graduation point to the need to reduce the inequity in broadband access to avoid further harm to communities which have experienced disinvestment and longstanding racism. Next slide. ArcGIS Pro. Back one, thanks. ArcGIS Pro was the tool we used to create this series of maps, which were included in the GIFs and in this static image in the data spotlight. Map visuals allowed our readers to easily compare these socioeconomic metrics and the neighborhoods that had been redlined and to see the similarity in the spatial patterns. The GIFs mimicked the ability to layer the data on a map, and they were useful for drawing attention and interest to the story. Additionally, we used the underlying data to help determine meaningful cutoffs for the maps, with the goal of presenting the most distilled version of the spatial trend and protecting the integrity of the information, while still making the maps simple and quick to visually digest in the form of a GIF. We started with a cutoff of 75% or 1 in 4 for every map, but this cutoff didn't make sense for every measure we wanted to display. For example, the majority of the population in Milwaukee has completed high school, and there are very few census tracts where more than 1 in 4 people have not. At the same time, Milwaukee's homeownership rate of roughly 50% meant a 75% cutoff wouldn't have told us much. By using 50% for this measure, we were able to see the neighborhoods that were lagging behind the county average. Next slide. Initially, maps were created for the larger Milwaukee metropolitan statistical area, but the rural census tracts in the counties surrounding Milwaukee were very large and they distracted from the message we were trying to communicate. So the maps were changed to focus on just Milwaukee County. Multiple color schemes were tried for the different maps, including graduated, diverging, and bivariate, with redlined neighborhoods displayed with varying transparency over the maps with other measures. But with our audience in mind, we decided that showing each map in one color would be easiest for communication. Next slide. Returning to the data spotlight, we concluded it with research about what strategies have been shown to improve broadband access. For example, providing low-cost internet along with low-cost computers and training can improve access, and public-private broadband partnerships have demonstrated effectiveness at lowering prices. County health rankings and roadmaps works to move data to action. We don't want to stop with just naming the problem. We also want to provide a way for communities to implement evidence-informed action. This strategy, broadband initiatives for unserved and underserved areas, was linked at the bottom of the data spotlight and is one of more than 400 evidence-informed policies and programs included in a database on our website called What Works for Health. This data spotlight web publication and social media GIFs is just one example of the type of product County Health Rankings and Roadmaps produces. We continue to work in this space of illustrating the connections between health and place and supporting our data and research with maps. Next slide. I just once again want to acknowledge my teammates and everyone at County Health Rankings and Roadmaps who contributed to this publication and presentation. And if you go to the next slide, this is where you can find County Health Rankings, our website, and follow us on Facebook, Twitter, LinkedIn. And we also have a newsletter that you could subscribe to if you're interested in seeing updates on our work. Thank you so much.
All right, thank you, Jess. So our final presentation of the session, David Tulloch is a professor of landscape architecture and the associate director of Rutgers Grant F. Walton Center for Remote Sensing and Spatial Analysis, where he leads the GeoHealth Lab. Over the last 25 years, his teaching at Rutgers has included undergraduate and graduate GIS courses, GIS-informed design studios, and professional training. So in just a second, we're going to have David here discussing developing a geospatial database for longitudinal study of urban childhood obesity. As soon as I've finished juggling some windows here. My apologies, David.
Nope, no problem. You can hear me fine though?
Yes, I can hear you just fine.
Right.
And in a moment, I will cut off so y'all will not hear me. All right, David, it's all you.
Great. Thank you, Laura. And good morning, everyone. Greetings from New Brunswick, New Jersey, the easternmost outpost of the Big Ten. And I know Harvey's bio mentioned he got his PhD from a certain Big Ten school. So I'll mention mine is from Wisconsin. So go Badgers. So Laura, I can't see the slides. Are they, I don't know if it's just me.
I'm sure it's not. Hang on just a second.
Okay.
Yes, I'm really good at forgetting to hit the share button that says you really mean it. So can y'all see it now?
Excellent. Yes. Thank you. All right. Good morning. A child's neighborhood can absolutely shape their life. Access to healthy food, scary neighborhoods to walk through, active living, places to work out, corner stores that have more chips than fruit, are all parts of the ways that our neighborhoods can affect our human health. And so for the last 15 years, our research team here at Rutgers and also at Arizona State University have been using GIS as a vital tool for trying to understand how the urban landscapes of New Jersey shape childhood obesity. Advance. This is a sidewalk in New York. Not many of the neighborhoods that we get to live in have sidewalks that bring the health to you quite like this, right? But looking at the neighborhoods in our cities, we've certainly found some findings that have been worth sharing. But with the GIS focused audience today, I'll still go through those, but I want to jump ahead a little and talk about the actual database, the longitudinal database, and a couple of the lessons that have come out of that as well. And the nature of multidisciplinary geospatial health research that comes with that. So I'm going to give a brief overview of our research journey and a few of the methods. And when I go too quickly, know that I'll be putting out links to some of the actual papers on Twitter. In fact, I've already started to do that, and I'll give you that handle at the end. Also, a quick note, and you can go ahead and advance, Laura. The images and the maps I'm using today range from polished, published final maps to some very rough internal data reports. Because this was this chance to reflect on 15 years of work that this project has gone through. And again, I felt as a GIS audience, we might enjoy that mix. Our early explorations of the food environment started with this project with the Food Trust of Philadelphia, looking statewide using commercial sales data to actually represent food availability. We discovered in the project what shouldn't have been a surprise, that some of the flaws that come with using commercial data could be a problem. They weren't for that project a fatal flaw. It was an exploration and visualization, but it moved us in a different direction as we moved into some more serious epidemiological work. Advance. So looking at 4 cities in New Brunswick here, we've partnered with epidemiologists at the Center for State Health Policy at Rutgers, and as I say, a team that now includes several people at Arizona State University to develop an urban-focused, detailed approach for childhood obesity, with support both from the National Institutes of Health and the Robert Wood Johnson Foundation. The project compares childhood obesity, as in particular measured through BMI, with the food and the physical activity environment of these 4 cities, Camden, Newark, New Brunswick, and Trenton. And in focusing at those, also looking at the areas around the cities, assuming that a lot of these children have about 1 mile walking range. And that suddenly expands the study area to 50 municipalities here in New Jersey. Advance. So in 2008, we began what we didn't realize at the time was going to become an annual process of acquiring commercial data from multiple vendors, integrating them, comparing them with other sources, calling more than 2,000 individual outlets, visiting some in person, mapping and checking their locations against other spatial resources, which began more with some earlier aerial imagery and then moved to what you might expect now, sources like Street View. Advance. I'll point out these maps show Newark, the largest city in New Jersey, about 250,000 people. You'll keep noticing whenever we see a map of Newark, a big empty area to the lower right or to the southeast, and that is Liberty International Airport, Newark Airport. So you see that gap each time. That's part of what you're seeing. We didn't just map commercial outlets, we mapped parks and physical activity outlets. We use similar processes with those. It's worth pointing out in these cities, developing a database over time about parks, which sounds static, really becomes quite complicated. The parks in our cities include city, county, and state parks. A few NGO parks that function as public parks. And it's worth noting that while New Jersey has an impressive statewide GIS data infrastructure, and I hope you hear about that at some point, these individual cities do not have relatively robust GIS offices. And so local data was not something that was easily gathered to support the project. In fact, as we continued the project, we were constantly running into other researchers scrambling to cobble together their own databases of everything from sidewalks to inventories of facilities inside the parks, to the facilities inside some of the restaurants and other food outlets. The challenge here in these cities is finding paths from origin points, and now you can advance, thank you, Laura, from origin points, which originally were residences, later were schools, to destination polygons. Parks, of course, are not points, they're polygons. And some of the parks in our cities, including the Olmsted Design Park in the northern part of Newark, are quite large. We had to think of parks not just as polygons, but as a series of access points. So within the 4 cities, we had phone surveys of well over 1,000 children multiple times. And we were able to map those home locations using the New Jersey DOT street network data sets. We've estimated the walking distance from each home to the food that's closest, separating out the different kinds of outlets, supermarkets, fast food, bodegas, and then also the physical activity outlets and the parks. The physical activity outlets can include everything from ice rinks to gymnasiums, karate studios, yoga studios. The first time we estimated the walking distance on the project, we were doing this as a one-time deal and working within some limitations at that moment. Actually used a raster street layer and least cost path analysis. But as it became clear this was going to become something much larger, we switched to network analyst. And it enhanced a couple other things we did. It meant that we weren't finding the closest facility. We were able to get the distance to every facility from every student's home. And it also meant later when facilities got dropped or reclassified, we could do that with the resulting origin destination matrix instead of having to go back and rerun all of our analyses. So we realized we had a dynamic database, kind of a living database at some point. Advance. So this is the city of Camden showing you some of those outlets, but it's not just a map of corner stores, right? Which would have been actually, as it turned out, quite a project by itself. Or some of our other maps that show maps of supermarkets and fast food. These became a well-vetted, carefully checked, as I said, field confirmed data set, and one that began to develop across years of changing landscapes in our cities. And interesting, it didn't match what our community saw as using tools like Google Maps, searching. So the demand for the maps became high. And it's worth pointing out, one of the lessons along the way was the demand we got for these was for the maps, much more than the data. That the community groups were asking for these. In fact, we produced map books for each city with what ended up being a total of a few hundred maps that we produced. Showing these, getting feedback, making sure that our data held up under other uses. And making these simple maps with epidemiologists turned out to be more challenging than we'd anticipated as well. And we could talk about that at the end if we have a chance. Advance. So a couple early findings is I'm not going to make this about the findings as much as the database, but yeah, after 1,500 surveys and mapping all of these, we found a few key things. A student within a half-mile walk of a park was significantly less likely to be overweight or obese. And a student within a quarter mile of a corner store was significantly more likely to be overweight or obese. And it really changes the way we think about those cities. Advance. As I said, I'll share a few links on Twitter to the papers. They're relatively easy to find. But again, it's worth saying even the early findings led to some important analyses, but also point out that the New Jersey cities are different than some of the previously published cities studies that we saw from Seattle and Minneapolis. Advance. One more added twist was schools. So aside from parks and Little League and all the other activities we talk about, getting to school is incredibly important in these cities. Active commuting to school is what we call it. It includes walking, biking, and skateboarding. And it's an important source of exercise. And mapping schools, how hard could that be, right? Well, it turns out to be, in these cities, incredibly challenging in ways we didn't anticipate. Records about school locations in these cities is not always consistent. Some of these schools move quite often. Add to that high staff turnover so that when we call a school to verify its location 5 years ago, there's often no one that was at the school in that year. Fires, annex locations, shared locations, schools that nest inside other schools, and moves within the school year all have complicated this more than I'd anticipated. The urban environment seems in particular to be a place where this happens almost constantly. So that was tough. And then also, if we advance this, please. The mapping of schools was complicated by classifying them by year. In most communities, you could get away with elementary, middle, and high school. And in our cities, the grades often move fluidly between different schools from year to year, depending on space availability, with a number of schools that would only cover maybe a 2-year period. So for at least for graphics and other reporting, it was challenging. But for the analysis, the location was the key. Add to that, by the way, private and charter. Great. So the one more thing we looked at is an upgrade to the physical activity environment of the streets themselves. In many cases, this is a new bike lane, new crosswalks, just upgrades and improvements. They're turning out to have the potential to be an important addition to the city. For students, active commute to school, for walking and getting around their neighborhoods. So again, on this one, you may be able to see on the screen here, these are actually points for that walking distance. We're having to measure the walking distance to the closest point on that upgrade. So this database, one that changes every year, becomes another added complication. And rolling it together with all these other food, physical activity, demographic, and school data sets, we've developed a data set that inside the team we jokingly refer to as the big enchilada, a quite unhealthy food. And that data set will have some new results soon. Advance. So the findings from the project by themselves have been quite interesting. Some of them are the kinds that at first sound obvious, but nailing them down has provided an awful lot of detail. Like this one, kids who actively commute to school at early ages are more likely to still actively commute to school later. Simple, it was clear, it was picked up by more than 100 news outlets this fall. Advance. And other findings with these just show, the neighborhood matters for walking. It's all complicated. That's one thing. What factor matters the most? Background, demographics, all these, it's a very complicated formula. But I'll tweet out that link for a few more of these papers for those who want to dig in and unravel. Advance. So I just want to talk a little more about what we've learned from the data set. In a public health meeting, right, would go into the findings, but a GIS meeting, I do want to talk a little bit about some of the lessons we learned here, because reflecting on, we've learned so much from the development of this very large database. Aside from learning about obesity, we learned how those early decisions sometimes haven't held up, have also though locked us into some things. in the name of methodological consistency, we've resisted some other updates at times to process, to software, to other things. And of course, the flip is there's software updates that we can't resist, we can't fight against. But also the early decisions we've made about anticipating future changes has been a real challenge. When we're thinking about why change now and again in 2 years, there's that. The data themselves have changed, the vendors have changed, right? And some of it's just name changes and buyouts. Trade Dimensions becomes AC Nielsen. Info USA, I think, has had 4 different names during the project. But the data formats and the attributes that we can get have changed as well, especially as we're doing integrations and trying to make sure we're not missing potential outlets. We're buying from multiple sources who are all different. And that's one of the other lessons is how much you cannot trust one vendor's data set, because as soon as we buy another, there's always changes. And the descriptions of the locations, let me say though, these vendors have improved dramatically. We used to only get addresses. They started to use lat longs, but the lat longs include a lot that were only by zip code or city. But today the lat longs tend to match what you would consider sort of a first run in the Esri address match. So advance. I'll just say, the other change you can see here in the photo, and I know I'm eating into lunch, so I want to be careful here, but this was a street view from one of the early moments in the project, where when we did our address matching as a first course run, we'd get 60 and 70% matches to advance. Same location in a later street view looks so much better. And it seems trivial, but the difference between being able to pick out little bits of outlet names on signs, actually sometimes we really couldn't even tell if there was a front door on some of the facilities in the old photos. And of course in our cities, the coverage has improved so much throughout. Advance. So one of the final things is looking past the epidemiology and the public health and asking, do we actually know something new about cities as well? And the data exploration looking with the density of these different outlets is potentially interesting. Advance. As we begin to look at whether it's a change between the density of 2 different outlets or maybe a change over time, the same type of outlet. Aside from, again, the big hole in Newark that's an airport, we begin to see other patterns. Advance. So here we try to make a slightly more sophisticated comparison. We take the densities, we cut them into high, medium, and low density. In this case, we're comparing the corner stores and the fast food. And part of what we see here that catches our eye, at least, are some places where there's some real clustering that's occurring in these. If you look at the red, that is an area that is high in one of those and low in the other. Why would fast food and corner stores not go together, right? It really says something when there's an investment in corner stores and not fast food in a neighborhood, perhaps. And beginning to look at that. The dark blue, by the way, are the areas that are high in both, high density of both. So lots of unhealthy food in both of those locations, but there's some population hubs. So they do have a presence of supermarkets as well. Advance. 10 years later, when it changed, you may not have been able to see the difference between the maps very quickly, but I'll tell you that western panhandle of Newark, that's an area out near Seton Hall University. We saw some real changes. They may not be important. This is data mining, right? And the first rule of data mining is don't believe the first cut of the data, right? Noise becomes data really quickly. But the second rule of data mining is don't ignore anything. And that's where we're beginning to look at our cities in a new way. Advance. So having a longitudinal database, 15 years, a form of clean data that we don't see anywhere else in the public health community at this scale, is really creating some opportunities, and yet also has me looking back and just amazed at the change that we've seen all throughout that. but also I don't want to dismiss our findings. Look, where you live affects your health. That's a fundamental thing that we've got here. We know that our environment shapes our health, but figuring the details out, boy, it gets complicated fast. And as it turns out, also very, very slowly. Advance. Big projects require huge teams, a lot of science. I want to call out the GIS folks that have worked on it, in particular, Caroline Philippuk, Brenda Allen, John Bogner, and Bernardo Perez, but we've had so many contributions to this because that's the way this kind of science works. Advance. And I just want to thank you. As I said, I will keep posting some things. Oh, I thought I had my Twitter handle on here. It must be the last thing I took out. I'm easy to find. It's the GeoHealth Lab at CURA. We'll link some of these papers. Thank you so much, everyone.
All right, thank you, everyone. And we do have one question. It looks like our other presenters have answered their questions in the Q&A box, so thank you very much for doing that to save us a little time. An anonymous attendee has asked you, Dr. Tulloch, what years do your data cover? Will you be doing any map comparisons of 2010 block groups to 2020 block groups, excuse me, or 2000 to 2010? If so, how does your database handle changing census geographies?
So first of all, we're really lucky that in our cities, the changing geography, the changing of people has been dramatic, but the changing of the geographies has been very limited. But our data collection has continued past 2020. And so yes, we are looking at how those data from the census fit with changes that we're seeing both in the physical landscape and in the health of the residents that we're seeing. So that's to come, but yeah, we're absolutely looking at it. And like I said, we are lucky. Our cities are changing in ways that within at least the way you frame the question are much more of a concern about human